So, hello, dear students. My topic will be about evidence-based medicine. Extensive scientific investigation of drugs in man and introduction of numerous new drugs over the past few decades is gradually transforming the practice of medicine from experience-based, wherein clinical decisions are made based on the experience of the physician, to evidence-based, wherein the same are guided by scientifically credible evidence from well-designed clinical studies. Evidence-based medicine is the process of systematically finding, evaluating, and using contemporary research findings as the basis of clinical decisions. So, what is the advantage of evidence-based medicine? Knowledge of the mechanism of action of a drug doesn't prove the usefulness of the drug in treating a particular disease. Therefore, to justify the treatment of a particular patient, it's better to have not scientific considerations about how the disease develops, but scientific evidence. Then in such patients, such an intervention helps to achieve the desired results beneficial for the patient. This is the approach that underpins evidence-based medicine. So, categorization of levels of evidence in different types of studies. So, the first main category is meta-analysis, randomized double-blind controlled trial. It's like a gold standard of all the evidence. So the next step, it's non-randomized controlled trial with concurrent controls. Next step, it's non-randomized trial with historical controls. Fourth, it's case control study. Fifth, crossover trial. Sixth, observational results. So it can be open non-randomized trial without a comparison group. And the last name is descriptions of individual cases. So levels of evidence, we have 4 levels. It's A, B, C, D. A level, it means that this trial was in randomized, so it's randomized controlled trials. In this search, it was used a large number of observations. Next level of evidence, B, it's a randomized control trial, but limited number of observations. C level, non-randomized studies. And next level is D, the last. It's a set of opinions based on a clinical experience. So, and what does it mean, randomized trial or randomization? So the subjects are allocated to either group using a preselected random number table or computer program, so that any subject has equal chance of being assigned to the test or the control group. If considered necessary, stratified randomization according to age, sex, disease, severity, other patients' variable may be adopted. And what is a blinding clinical trial? So this refers to concealment of the nature of treatment, test or control from the subject or both the subject as well as the investigator. So nobody knows about the drug that have a clinical trial, and patients and researcher. If it's double, if it's single, only patient doesn't know about the drug. So, randomized control double-blind trial is the most credible method of obtaining evidence of efficacy, safety, or comparative value of treatments. Meta-analysis. This is an exercise in which data from several similarly conducted randomized control clinical trials with the same drug, examining the same clinical endpoints, is pulled to bring out the overall balance of evidence by enlarging the number of test and control subjects and increasing the significance and power of the conclusions. Next, cohort study. So this is a type of observational study in which no intervention for the sake of the study is done. Cohort is a group of individuals having some common feature. Case control study. This type of observational study is used mainly to reveal association of a suspected rare adverse event with the use of particular drug. Cases of the suspected adverse event are collected from hospital records or disease registries. So, grades of strength of evidence. We have 4 grades. So, grade 1. Grade 1 means if searching was like meta-analysis, systemic reviews. So grade 2, it's well-powered randomized controlled trial, more than 1 trials. Grade 3, open label trials, pilot studies, observational, cohort and case control studies, prospective or retrospective. Grade 4, it's case reports, anecdotal reports, clinical experience. So, like you understand, better of all if the searching has grade 1 and was it grade 4. So, in stages in new drug development. What's the stages? So, firstly, the drug should be synthesized. We should find the compound of the structure. For this stage, it's needed for 1-2 years. Next, it's preclinical studies. So, screening, evaluation, pharmacokinetic, and short-term toxicity testing in animals. For this study, we need for 2-4 years. Then it's a scrutiny and grant of permission for clinical trials, 6 months. Next, pharmaceutical formulation, standardization of chemical, biological, immunoassay of the compound is before 1 year. Next study, it's one of the most important, it's clinical studies, it's clinical trials. So, and clinical trials consist of mainly 4 phases, 1, 2, 3 phase, and then here it's only 3 phases. And so next it's review and grant of marketing permission. It's before 2 years kind of. And the last, it's phase 4 of clinical studies. It's named like post-marketing surveillance. So here it can be a very lot of time for this stage. So, clinical studies are basically of the following 3 types: clinical trials, cohort studies, and case control studies. This is a picture about, we shortly said, so that firstly, the drug should be found in laboratorium. Then the drug should be performed in preclinical research on the rule it's on animals, on monkeys, and then we should start clinical trials. That here you see 4 phases. So, and preclinical studies, one more. So after synthesizing, identifying a prospective compound, it's tested on animals to expose the whole pharmacological profile. Experiments are generally performed on rodent, mouse, rat, guinea pig, hamster, rabbit, and then on a larger animal. And so clinical trials performed only on a human. So according to GCP, good clinical practice, and adherence to this provides assurance that the data and reported results are credible and accurate, and that the rights, integrity, and confidentiality of trial subjects are protected as enunciated in the Helsinki Declaration of the World Medical Association. So, let's describe these 4 phases. Phase 1, named like human pharmacology and safety. So, from this phase, we only start to give these drugs on the people. So, what here we want to know. First, human administration of the drug is carried out by qualified clinical pharmacologists, trained physicians, in a setting where all vital functions are monitored and emergency facilities are available. So this phase 1 can be performed only on 20-80 people or subjects, and starting with the lowest estimated dose and increasing stepwise to achieve the effective dose. The emphasis is on safety, tolerability, and to detect any potentially dangerous effects on vital functions such as precipitous fall, rise in blood pressure or heart rate, arrhythmias, bronchospasm, seizures, kidney, liver damage. Unpleasant side effects are noted in attempt is made to observe the pharmacodynamic effects in man. The hemopharmacokinetic parameters of the drug are measured for the first time. No blinding is done. The study is open label. Phase 2. Therapeutic exploration and dose ranging. So here you see patients can be more from 100 to 500 people. So the primary aim is establishment of therapeutic efficacy, dose range, and ceiling effect in a controlled setting. Tolerability and pharmacokinetics are studied as extension of phase 1. The study is mostly controlled and randomized and may be blinded or open label. It's generally carried out at 2-4 centers. Next, phase 3, a name like therapeutic confirmation comparison. So here patients can be more from 500, 3,000. And at many centers in many countries the session can be performed. So the aim is to establish the value of the drug in relation to existing therapy. Safety and tolerability are assessed on a wider scale, while pharmacokinetic studies may be conducted on some of the participants to enlarge the population base of pharmacokinetic data. Indications are finalized and guidelines for the therapeutic use are formulated. So a new drug application submitted to the listening authority. So after phase 3, the drug can be brought in chemists. And next, phase 4, post-marketing studies. So it's not necessary phase, it cannot be performed, but and can be. After the drug has been marketed for general use, practicing physicians are identified through whom data are collected on a structured perform about the efficacy, acceptability, and adverse effects of the drug. So patients treated in the normal course from the study population. Numbers, therefore, are much larger. Uncommon idiosyncratic adverse effects or those that occur only after long-term use and unsuspected drug interactions are detected at this stage. So it's stage when we know about more adverse effects, about more interactions between the drugs. So it's like it's a final phase of teaching. So further therapeutic trials involving special groups like children, elderly, pregnant, lactating women, patients with renal hepatic disease, so may be undertaken at this stage. Because on first, especially second stage, it's on first stage it's only healthy patients should be on the second stage with the minimal diagnosis. So on phase 4 we can take practically everybody. So, and this is all for evidence-based medicine that you know. Thank you for your attention.